Now, a rehab centre in Doddington is using virtual reality tech to help people recovering from strokes. The aim is to simulate everyday activities to help patients become more independent. Sara Neaves is the clinical lead and outpatient services manager at Askham Rehab. Sara, good morning.
Good morning. Good morning. How are you all?
Yeah, very well, thank you. Thanks for joining us. So what does this technology look like? Is this the virtual reality headsets that you're using?
Yes, it is. So the Ulysses, which is a neuromersiv company device, is very much looks like a VR or virtual reality set that you would find in any sort of high street store, really, which sort of sits on our patients' heads, top of their heads, and looks like a pair of goggles, I guess, really. So it sits very comfortably around their eyes and the top of their nose. Which enables it to be usable for anybody. Anybody can use this bit of kit, basically.
Okay, so you put the goggles on. What happens next?
So then you enter a completely different land. I mean, it feels like you're in a very functional setting. So we're using it for functional rehab because obviously people who come to us have had neurological events, so strokes, which is sort of permanent sort of damage to the brain. So we use these devices to take them into functional rehab, so the kitchen or the bathroom, which allows us to train them functioning in a really safe manner. Obviously, we will do this in a natural kitchen or bathroom because you want to emulate exactly what they're going to experience at home. But it's really important that we start functional rehab really early on in their rehab journey. And this device allows us to do that very early on in a very safe environment, alongside traditional rehab technologies.
Okay, so once you've got the headset on and using the virtual technology, you are in a virtual reality kitchen, what will you get people doing?
Yeah, so we'll ask them to use their affected side and train that side functionally for functional movements. So things that you and I take for granted. You know, we take for granted walking to the bathroom, putting our toothpaste on our toothbrush and using probably our dominant hand to brush our teeth. Unfortunately, somebody who's had a stroke will really struggle with that. So we're going to take them into that environment and emulate those day-to-day activities. So you're going to retrain their finger movements, their coordination, their dexterity. You're going to retrain sort of things that, again, we just take for granted on a day-to-day basis. But when it comes to a stroke, it affects everything, and it's such a huge impact into independence, and we want to train that back for them.
What difference does it make actually being able to take a patient into a virtual reality bathroom, say? Because, of course, you could practice like putting toothpaste onto a toothbrush without having the headset on, surely?
Yes, yeah, completely. And we will do that because actually it's really important they physically pick up a toothbrush and they physically put on that toothpaste. But what this allows us to do is to retrain that movement really, really early on so you get the correct patterning of movement. Because what can happen is that people will try to do those movements, and if the pattern is not right, they're never going to quite get that right movement. They're never going to quite get that right coordination and that pattern of movement to enable them to move their hand to pick up the toothbrush, put the toothpaste on, and move their hand up to their mouth and brush their teeth, for example. This means that we can go in really early on. So even if somebody's in bed or they're in a chair and we can't take them into a bathroom for numerous reasons, it means that we can start working on that movement, we can start working on that patterning really, really early on. And recovery from a stroke is all about the neuroplasticity, and it's all about high repetition of movement. And to get that learning, we need to start that really, really very early on. And this system allows us to do that. It allows us to go in with all our different methods and learn how, teach somebody how to do this very early on in their rehab journey.
What kind of results have you seen, Sara?
So because this is fairly new to Askham, we're working with Neuromersiv on sort of a trial basis. So we're the only unit in the UK currently using this kit. Neuromersiv themselves have done some research in Australia, and it's delivered some really promising clinical outcomes. They've seen some improvements from very early on in regards to functional movements, functional patterns, and sort of those outcomes which, the patients come to us, they have those goals of being independent. They want to get back to their normal life as such. Strokes are incredibly debilitating, and for anyone who has experienced a stroke, it's just awful. So the outcomes that have been shown on the Australian research is really exciting and really promising, which is why Askham really wanted to experience this for ourselves.
Now that you've got to know the technology a little bit more and seen how your patients react to it, can you see more applications or more ways that you can use this tech to help people?
Yes, definitely. And I know we're working alongside Neuromersiv. So as part of our role as the trial unit, we're feeding back to Neuromersiv in regards to making it more functional. So at the moment, the kit is used for the functional training in a kitchen, in a bathroom, but we're hoping that will expand and will allow us to train different functional activities. But we're very fortunate at Askham. We're very innovative and we have some great technology. So we have robotics, we have use of FES. That means we can use all of these alongside our traditional methods to really improve somebody's outcome and hopefully their independence for going home.
Sarah, good to talk to you. Thank you for your time. Sara Neaves there from Askham Rehab in Doddington. She's the clinical lead and outpatient services manager and heavily involved in getting used to this virtual reality technology and using it to help stroke patients. You wonder if VR, it's still sort of on the fringes at the moment, but is it going to be more and more used in healthcare and every aspect of our lives within the next couple of years? It's interesting. We'll get the latest news from